Actually, you know what? I have another question for you. Is it okay?
Of course.
I have older students who advocate for themselves now, and they're getting more au fait with the types of medications that they use. And I know that some students would like to just take their short-acting medication just to help them with their study. Do you think that's an appropriate thing for older students to be doing, if the pediatricians have given them that choice? Or what are your thoughts on that?
My thoughts are ADHD is with you 24/7,
Mm, mm,
right? And ultimately it's your decision. Um, but you need to see what you're like without it,
mm,
right? And it again goes into, the medication holidays that some people do.
mm,
I think it's easier for consistency,
mm,
right? So maybe, I guess it depends how the ADHD is being managed in the situation. I mean, sometimes there's a combination, right? So there's not just one medication using, and if they have one that they can help bring up,
mhm,
that stimulant to help them study. But you have to remember that ADHD has a neurobiological basis and it is a chemical imbalance,
mm,
right? So it's easier for your brain to have that predictability of having that constant steady state than
mm,
having a lot of peaks and valleys. But it's a personal opinion, and you have to do what's right for you and what you think it is. But it may be that for these students, they look at having two options, right? Something to help them consistently, and then that little bit extra when they need that more intensive support, right?
mm, mm,
Because if they're on a low dose regularly, that helps them on the day-to-day tasks, but then need that little bit of extra support around exam time, that's different. um I would think about someone with diabetes, right, who's an insulin dependent type 1 diabetic. So they're gonna have a treatment that's standard, right? But they're gonna have peaks and valleys when they need that little bit extra to support it,
mm,
right? Or someone with like migraine headaches. If they have chronic migraine headaches, they may be on a medication daily to help them control their migraines. But then they're still going to have instances where they have that breakthrough migraine that's really intense and they need more support to help them through that time. So they take additional painkillers,
mm.
right?
But both those ideas, referring to it as diabetes uh, and the migraine, I think are very good uh, tools to help us make judgments by too. I
Mhm.
believe as some kids get older, because some ADHD, because it presents so differently in
Yeah.
different situations. I think this is why people have those holidays, because the stress that some of these kids are under in the school situation is the only time they actually need that support in
Yeah.
their home environment, because the parents are flexible and they're in tune, that they don't need those supports too. But yeah, I always tend to say, look, it's a discussion you should have with a pediatrician or your doctor. But yeah, I think once they've had a good, once they're starting to advocate and have a very good feel for their experience with the medication, because often it changes. I know sometimes I advise people it takes about 18 months to actually get it right.
Mhm.
And then you'll get it right and go through a growth spurt. And
And then you have to adjust. Yeah,
yeah.
well, that's the thing, and it's very tricky when you make those transitions, right? Elementary school to middle school to high school, because the demands are changing, and that's a very tricky transition period. And then even from high school to adult life, are you going to do different schooling? How is it going to look? And
Mm,
each of those system or situations is going to have the ADHD present itself differently.
mm,
And if you're choosing a situation that you don't need that high intense focus like you do in school, then it may not be appropriate to be on that. But no, look, I'm going to have this situation where I need it, and take it then.
Mm, mm, mm. Always, I think I'll always say, parents, if you're considering it, then always talk to your pediatrician too.
Well, and that's very important. Do it under medical advice.
Yeah.
Don't take, I have a PhD in education, I am not a medical doctor. I am not a I'm not a psychiatrist. I am not a GP. You need to talk to a professional that knows about this, because medication is very tricky, but there's nothing wrong with talking to them and having an open conversation and explaining why, right? Don't just say, because I don't want them to be on medication. Yeah. That is a valid reason, but saying why you think it's appropriate to remove it. And you know what? Yes, there's the stigma with being on medication, but if it's making your life that much better, like it's very hard, but it is difficult to psychologically process sometimes that, you know what, hey, for me to work my best, I need to be on medication. Yeah. And that's my neurodiversity.
Yeah. I think for our younger people, the role of medication is so important because it allows that behavior. But I believe the best strategy is the medication and the behavior. But as you've gone through all that behavior, then the medication plays a different role. But I think the best way to learn to manage ADHD is with medication and a behavior program, whether that's a coach, OT, speech pathologist.
Right? Sorry. Pills don't teach skills.
Absolutely. Yeah.
Right. You need the skills and the skill support to work with the ADHD, because even if you are on that stimulant medication, even if you're able to focus more, you still need the skills to work in that situation. So any intervention for an individual with ADHD or any neurodiversity needs to have multiple angles that it uses, right? You can't just focus on one thing and think it's going to be fixed.
That's right. Well, we better finish up. Yeah. What else is happening on Garforth Education at the moment? What have you got coming up there for us, Dr. K?
Right now, it's just working on the psych ed terms explained, which is where I'm taking terms that you're going to come across in a child's psychoeducational assessment and telling you what it means and what how you might see it with your child and what you can do to help support your child with them. Other than that, I'm really excited. Tomorrow I'm going to be filming some more of my Mythbusters. Last month I went through a lot of myths with Selena Lee, the ADHD Whisperer, on ADHD. I know you and I are planning on to do some more. Tomorrow I'm going to be filming them about Down syndrome.
Great.
Because, I think it's really important that we help bring awareness to these different issues, that there's a lot of things that we don't realize. And I know I was reading through the list and there were some of them that I even was wrong about. Like, I didn't realize that individuals with Down syndrome can actually get a driver's license. In some situations, I just
thought about it.
They couldn't. But it's not true. They can.
Sure.
If they pass the test, right?
Yeah.
So I'm really excited about those and looking forward to do some more on autism and dyslexia, learning disabilities. But how about you? What's happening in exceptional learners?
We're getting towards the end of our school year and our school term, and it's starting to get very warm. So everyone's starting to get very tired. But we are starting to plan for the next year. So I'm working with families, individuals, looking at IEPs and what needs to change to make sure that they've got really good, reasonable adjustments. And the work I've been doing lately is really closely matching appropriate executive functioning strategies to the executive functioning profile of kids. And that's what teachers are telling me is making a real difference. We're trying to get across that it's not the presenting behaviours that you might see in the classroom, it's the underlining cause or the underlining reason for some of the presenting behaviours is all around executive functioning. So I'm starting to work with some schools and book up dates to visit schools and present at P&Cs as well, and booking all that up for next year. So
wonderful.
Winding up, but starting up.
Yeah, well, IEPs are such a huge thing right now. It's IEP season here because we're just starting to look at them now that we've had a couple months into school. And it's really important on seeing how we're wanting the support to help the student and not just having vague goals and objectives and strategies, actually saying what that strategy is trying to be used to accomplish something.
Yes, yeah. And, you know, even though we talk about having SMART goals, you know, sometimes people just need to remind that it needs to be measurable because that data is so important. And if it doesn't work, great. We found something that doesn't work. It doesn't matter.
I think the big thing with that is you need to record it and have it on record in those IEPs as a strategy that had been tried and did not succeed. Yes. So later down the line, when there's another teacher, you don't waste the time from trying it again.
Yes, absolutely. Get everything in writing, have the data there. Well, Dr. K, always a pleasure to talk to you and have your insights. And thank you so much for those insights. Thank you so much for joining us.
Thank you for having me.
And ladies and gentlemen, boys and girls, join us at Exceptional Learners or Garforth Education for more tips and tricks and ideas. I know that Dr. K has a plethora of videos on her YouTube channel as well, which are, you know, I think are wonderful because you can pick and choose when you need them. And sometimes it's great to revisit those. Anyway, thanks everyone for joining us and see you again soon.
Take care.